At this point in time, we have 231 Australians in hospitals, and 75 of those patients are in intensive care units, with just under 40 requiring ventilators for support of their breathing. The global total is 1.7 million, and there have been 101,000 deaths. I'd like to make two specific points today in relation to two of the initiatives that the Australian government have put in place to protect Australians during this difficult time. The first one, as you're aware, is our reform of Medicare to expand telehealth. And telehealth to date has had over 3 million consultations with 2.4 million patients. Now, that's important for two reasons. The first one is that it means that doctors and patients have a way to interact that's obviously not face-to-face. But more importantly, it means that those with chronic diseases in our community who require interaction with their general practitioner are able to do so. Secondly, I want to mention our mental health services, and although there have been a number of announcements by the Minister in the past weeks, in particular the most recent, the Coronavirus Mental Health Wellbeing Support Service, which is we are supporting through our colleagues at Beyond Blue, and I would direct Australians who are in need of support at this difficult time to the website www.coronavirus.beyondblue.org.au. And just before I take questions, I want to make a particular statement about how difficult this has been for Australians, in particular during this difficult time over the Easter break. We have asked you to change the way we live as Australians essentially overnight. And essentially overnight, we've come together as Australians and done just that. And it's because of that reason that we can continue to give you, for several days now, and including today, good news about the number of cases that are occurring. But we need to sustain those gains. We need to keep those number of cases low. We need to have that opportunity now to chart our way through and out the other side of this COVID-19 epidemic. With that in mind, I can take some questions.
Doctor, first, if you would, you talk about the very good numbers of COVID cases in terms of the whole population. I understand healthcare workers' infections in the state of Victoria have doubled in roughly the last week. Isn't that evidence that we're not doing enough to protect healthcare workers in this crisis? And how concerned are you about that trend?
Well, we're concerned about every single case of COVID-19, and every single case needs to be investigated thoroughly. But in particular, those amongst healthcare workers need to be thoroughly investigated. We need to understand precisely how the healthcare worker acquired that infection. We need to know exactly the circumstance, and I know that the state and territory public health units, particularly those in Victoria and New South Wales, are looking very closely at healthcare worker infections in those states. We discussed healthcare worker infections today at the Australian Health Protection Principal Committee, and we are making every effort that we can to understand how those infections were transmitted, including using molecular techniques that can tell us exactly which patient the virus came from and who they were transmitted to.
Do you believe that a lack of masks might play into this in some way? I know the government has announced increased efforts to get masks to healthcare workers. Is it a factor, or is it nothing to do with the problem?
I don't think it's a lack of masks or PPE is anything to do with these current situations in Victoria and New South Wales. As we've said, the National Medical Stockpile has been releasing millions of masks, not only surgical masks but N95 masks for airborne protection. So the number of masks within the Australian community and healthcare community at the moment is sufficient, and we're supplying them in very large quantities to the states and territories, including over 11 million that have come in during the past week. So no, I don't think that's a factor.
Dr. Coatsworth, in terms of talking about sustaining the gains and keeping people at home, department stores like IKEA and Bunnings are still open. Is that sending mixed messages? Is IKEA an essential service right now?
I don't think it's sending mixed messages. I think that, you know, to keep Australia at an appropriate level of social distancing, we do need some things in our community running. So whether you're talking about IKEA or whether you're talking about Bunnings, people still need to furnish their homes, do their repairs. They still need to call tradespeople around and so on and so forth. So that sort of thing needs to continue. And we do know that the local managers of those stores and Australia-wide are actually putting in social distancing restrictions within the stores themselves. I was at Bunnings the other day. It was very clear where I had to stand in order to maintain distance. So I think you can do both of those things, and I'd like to thank the Australians who are going to those stores for maintaining the distance and the stores themselves for putting in those rules.
Around 100 Australians have been evacuated from the Greg Monteblanc cruise ship in Uruguay. What are the medical concerns? They're preparing to be brought back to Australia, to Melbourne. What are the medical concerns about bringing back travellers from somewhere where there has been an outbreak of the illness?
Well, there are obviously medical concerns about doing that, which is why this entire operation has been meticulously planned, led by the cruise ship operator, but with support from the Department of Health, Department of Foreign Affairs, Australian Border Force, Victorian Government. This is a very important thing that we have to get right, but equally we have to bring these Australians back, particularly when our understanding is that over 70% of the just over 100 Australians that are coming back have tested positive to coronavirus. So I'm aware of the detailed plans to meet that aircraft when it arrives tomorrow morning, make sure that all the passengers get a thorough medical assessment at airside, and then depending on that medical assessment, either go to hospital, and that the hospitals are prepared for that, or go into hotel quarantine.